Welcome to our YouTube breakdown of Macrophage Activation Syndrome, or MAS, a hyperinflammatory beast that can strike fast and hard. Let's kick off with what causes it. MAS is triggered by systemic inflammatory conditions like juvenile idiopathic arthritis, lupus, or adult-onset Still's disease. Infections like EBV or CMV, malignancies such as lymphoma, or certain drugs can also set it off. In genetically susceptible patients, these triggers unleash an immune system firestorm. Now, let's dive into this chaotic whiteboard picture, already drawn, to unpack MAS's clinical features, lab findings, diagnostic criteria, and treatment through its vivid metaphors. First, the clinical features, the commonest signs you'll spot. Check out that massive explosion in the center, flames bursting everywhere. This is non-remitting fever, the hallmark of MAS, driven by a cytokine storm, IL-6, IL-1, and TNF-alpha going wild. This persistent, high-grade fever doesn't quit, unlike infectious fevers that dip. Next, see that grenade, bulging ominously? That's lymphadenopathy. Swollen lymph nodes come from macrophages and lymphocytes piling in, often misdiagnosed as infection or cancer. Look at the figure falling, blood spilling around them. This shows bleeding. Overactive macrophages in the bone marrow gobble up platelets through hemophagocytosis, causing thrombocytopenia and coagulopathy. Think petechiae, or severe bleeding. Notice the swollen liver and spleen spilled on the ground. That's hepatosplenomegaly. Macrophages and lymphocytes infiltrate these organs, making them enlarge, a key physical exam finding. See that figure with a cracked helmet? This represents central nervous system symptoms. The cytokine storm hits the brain, causing confusion, seizures, or coma, a sign MAS is escalating fast. These are the core clinical features: fever, lymphadenopathy, bleeding, hepatosplenomegaly, and CNS dysfunction. Now, let's move to the lab findings to complete the diagnostic picture. See that tall malt bottle? Sugar spilling out. That's elevated liver enzymes. AST and ALT spike from liver inflammation due to macrophage infiltration, signaling organ damage. Spot those iron scraps piled high. This is hyperferritinemi, a hallmark of MAS. Ferritin often soars above 500 nanograms per milliliter, driven by intense inflammation, unlike what I got wrong earlier. Look at the fallen cheese on the ground. This represents hypochlorhydria. Low cholesterol reflects liver dysfunction and systemic inflammation, a subtle MAS clue. There's a tall milk bottle standing proud. That's elevated LDH, or lactate dehydrogenase, rising from tissue breakdown and hemolysis as macrophages attack blood cells. Notice the broken plates scattered across the board. These are cytopenias, low red cells, white cells, or platelets from bone marrow suppression via hemophagocytosis. Check out that fiery mess of debris. This is hypofibrinogenemia. Low fibrinogen fuels bleeding, tied to liver dysfunction and consumptive coagulopathy. See that cracked vinyl album? That's hypoalbuminemia. Liver impairment and protein loss drop albumin, leading to edema and worse outcomes. Finally, look at the rolled out carpet. This represents low ESR, or erythrocyte sedimentation rate. Paradoxically, despite MAS's inflammatory state, ESR is often low due to hypofibrinogenemia, a key diagnostic hint. Now, let's talk diagnostic criteria. Based on guidelines like HLH 2004, adapted for MAS, you need at least 5 of these: persistent fever, cytopenias affecting 2 or more cell lines, hyperferritinemi, hypertriglyceridemia, or hypofibrinogenemia, and hemophagocytosis in bone marrow. Also, watch for elevated soluble CD25 and low NK cell activity. A high ferritin to ESR ratio can help, as ESR is unexpectedly low. Next, check out that small face next to the fallen figure. This represents treatment with cyclosporin and methylprednisolone. These are your heavy hitters to shut down the cytokine storm. High-dose methylprednisolone tackles inflammation fast, while cyclosporin suppresses T-cell activation. Biologics like anakinra may also be used for refractory cases. This whiteboard picture, explosion, grenade, bleeding figure, and all, shows MAS's chaos. A trigger like a virus or autoimmune flare sets off defective T cells and macrophages, releasing cytokines that drive fever, organ damage, and cytopenias. Spot these signs early, confirm with labs and criteria, and hit it with treatment to save lives, as MAS can mimic sepsis or malignancy. That's the MAS breakdown. Drop your clinical tips in the comments, share this with a colleague, and subscribe for more medical deep dives. Stay sharp.